African leaders have adopted a presidential declaration to produce at least 60% of health products locally by 2040. The South African Pharmaceutical Producers Association, chaired by Dr Stavros Nicolaou, has welcomed the announcement, saying the declaration supports increased investment in skills development, innovation and technology transfer. Well, we're joined live now by Dr. Nicolaou just to unpack this a little bit for us. Thank you for your time, Doctor. I think let's start about the significance of this. When we talk about some of these products, health products in Africa, one can only remember the time during COVID when African countries were scrambling for access, and the conversation about us having the ability to manufacture our own products really came to the fore. Is this a possible target?
Firstly, good afternoon, and thanks very much for having me again. I'm freshly returned from Addis Ababa, where this session was held on the margins of the African Union Heads of State meeting. This announcement is not a new one. It's a reinforcement of an existing announcement. And as you correctly state, during COVID, every single one of us on this continent, all 1.4 billion of us, felt the cold shoulder of the rest of the world when it came to receiving and or procuring medical countermeasures, vaccines, pharmaceutical products. These were very often basic pharmaceutical products. So the announcement or the reinforcement of the announcement is very welcome, but I guess the proof is always in the pudding. And I think what was important this weekend was that a special session was convened, and this is going to lead to an announcement in April 2026 in Nairobi, during again a further special session which will focus on pharmaceutical manufacturing on the continent. The champion for pharmaceutical localization on the continent is Kenya's president, Dr. William Ruto, and Dr. William Ruto will be hosting this extraordinary meeting in April, and we are hoping out of that meeting that there are expedited pathways to both registering products in Africa, but also to Africa procuring its own products for its own citizens from its own manufacturers, which is presently not the case. And I'd like to just add one other thing without becoming too verbose here. You know, charity always starts at home, and this initiative was started off by President Ramaphosa in 2020 and 2021. And I do think we first need to fix our own procurement rules here in South Africa. We still rely very heavily on imported pharmaceutical products. So I'm hoping that the domestic and the continental landscapes speak to each other, and that we can actually start accelerating the procurement of African produced products from African manufacturers for African patients.
And you're absolutely right to say that they should definitely align in regards to how it's done domestically and, of course, throughout the entire continent. And that would lead me to my next question to say, do we have the infrastructure? Do we have the know-how? And perhaps maybe which countries would be the driving force behind some of these locally manufactured medical supplies?
Look, South Africa still leads the continent. I mean, we are the most pharmaceutically industrialized country on the continent. But certainly there are other countries, Egypt, Morocco, Nigeria, Kenya, just to mention a few others. But certainly we lead the way and we pave the pathway for the future as South Africa. But as I said earlier, we do need to fix our own local procurement rules in South Africa. For example, it is inconceivable that President Ramaphosa assented to the Public Procurement Act 22 months ago, and yet we have not had sight from Treasury of the public procurement regulations. So this means that the Health Department, which is the biggest procurer of pharmaceuticals in South Africa, is not obliged to follow the public procurement legislation. Now, juxtapose that against many of our other competing countries on the continent. As I mentioned earlier, I'm fresh back from Ethiopia, and Ethiopia gives its local manufacturers, local farmer manufacturers, a 25% premium on locally produced products. We have no such dispensation in South Africa, and it's little surprise then that our, for example, antiretroviral tender, which is by far the biggest and largest ARV tender, HIV tender in any country in the world, it's little wonder that we are now in a position where we are importing 70% plus of our antiretrovirals. So these things need to be fixed with absolute urgency. As I said, it's somewhat outrageous that we have the biggest HIV program in the world, but yet we import most of our medicines. Now, pharmaceuticals are a great export opportunity for South Africa, but you need to leverage your domestic public sector volumes in order to get economies of scale so you can become export orientated. So we need to fix this public procurement dilemma, as I call it. We need to fix it with speed and urgency. We're fast and rapidly running out of time. And we do need a more streamlined regulatory system, both here in South Africa and on the continent. Now, when I was in Addis this weekend, one of the more important meetings we held was with the head of the Africa Medicines Agency. So that is the agency on the continent that is seeking to harmonize regulatory standards across the continent. It's called harmonization and mutual recognition. We're hoping that through a bolstered Africa Medicine Agency, which I might add is headed by a very competent lady called Dr. Mimi Dorcas. We had a good meeting with her. If we're able to get this mutual recognition across the continent, we can certainly accelerate our ambitions, both as South Africa and as a continent, to meet that 60% locally produced pharmaceuticals and vaccines from the continent by 2040.
And Dr. Stavros, I'm curious to ask about when it comes to Africa's traditional medicines. You speak about some of the largest HIV campaigns here in Africa, but access. We also are a continent with, vast resources when it comes to indigenous medication, African, traditional medication. Does this presidential declaration include that? Could this be as well an opportunity to also not just protect Africa's health security, but as you said, use this as well to boost the continent's economy?
Yeah, I think there are two important elements to your question. I mean, the first is one of the announcements that were made in Addis over the weekend, in fact, yesterday morning, was called Project Achieve. This is a funding facility for research and development on the continent. It's primarily for vaccines, but they are looking to expand the scope of it to include other pharmaceuticals. Now, we do have indigenous plants that are unique to our continent, but unless you get the environment and the landscape right, i.e. you get a seamless regulatory environment, you get procurement happening domestically and regionally, local manufacturing supported properly, until and unless you do that, it becomes difficult to succeed in backwardly integrating further into research and development. But the initiative that was launched yesterday was launched by the Institute for Vaccine Initiative, IVI, as they called. It was a $100 million facility that was presented, and the initiative is called Achieve, and it is very much focused on research and development, and a number of prominent African researchers were in the room at the launch, and these are the type of initiatives we need to pursue as a country and as a continent if we are to succeed. I mean, in South Africa, I serve on a structure called the Institute for Pandemic Preparedness. It's IB cubed is how it's abbreviated, and that is also one of many initiatives aimed at accelerating R&D and research in our country. But the reality is that we should be or ought to be spending 2% of GDP on innovation in our country, and it's significantly less than that. Not that spend should be a measure of how successful you are, because there are countries that don't spend 2% of GDP but are successful in research. I think what's required is a very particular mindset in our country, which hopefully we can infuse into the rest of the continent.
Yeah.
But also it requires prioritization. We need to prioritize certain research initiatives, those that are likely to land you the best success. We need to be more focused around this. And then I think you might start seeing an acceleration in R&D as well. But for now, we should fix the landscape, as I call it. We do need a more seamless, less burdensome or less red tape around regulatory aspects. We need that mutual recognition and harmonization I spoke about earlier. And most importantly, we need to support local procurement for locally produced products. We simply don't do that. And as I said, it's outrageous that we're importing 70% plus of our antiretrovirals into South Africa, when we have by far the biggest consumption of ARV products anywhere in the world.
And that definitely as well speaks to access for many patients in South Africa who are seeking some of that medication. Stavros Nicolaou, thank you very much for your time in unpacking that from the South African Pharmaceutical Producers Association. It will be very interesting to see if Africa can indeed reach that target by 2040. All right.